my name is Suzanne Gornell. I'm a clinical trials nurse at Memorial Sloan Kettering, and I've been practicing here for the past 19 years. I'm here today to talk to you about the common gastrointestinal effects of immunotherapy or checkpoint inhibitors on your system. Immunotherapy can lead to inflammation of any of your body's organs. GI toxicities or stomach issues or colon issues are the second most common toxicity, second to the skin. Gastroenterologists are doctors that take care of the stomach GI issues, and they're working more closely with medical oncologists these days to manage these issues. In suspected cases of GI inflammation, an endoscopic procedure or having an invasive procedure is sometimes needed to confirm a diagnosis. So there are different types of gastrointestinal toxicities, the lower GI tract and the upper GI tract. We're going to start with the lower GI tract. 1 is the colon, 2 is the liver, 3 is the pancreas. Liver and pancreas are typically managed more by lab work. You're not really having symptoms, and that's something we will address. The colon are symptoms that you may be having that you need to report to us. In most incidents, the symptoms of diarrhea and colitis, which is the inflammation of the colon, are mild and self-limiting. When there are moderate to severe symptoms, patients may need to be hospitalized and possibly discontinue treatment. Typically, if you're having some symptoms of diarrhea or loose stools that are, I'd say, around greater than 4 times the incidence of when you go to the bathroom a day. So if you typically have a bowel movement once a day, if you start going 5 times a day or it's very watery stool, you need to let us know. And initially we'll rule out C. diff is what they call it, or a kind of infection. And if that is negative, then we will move on and make sure that you don't have colitis. And if that's the case, you will then need to be put on an oral corticosteroid. Our biggest concern that we sometimes see with colitis is a bowel perforation, which can be life-threatening, which is why we take these symptoms very seriously. We always need to know if you're experiencing diarrhea or abdominal pain. And even if you're having diarrhea and you usually don't, let us know, even if it's twice a day, because sometimes this can be a cumulative side effect, which gets a little bit worse week by week. Sometimes when you come into the hospital for this diarrhea, you may need to get the corticosteroid by IV if your stomach's not absorbing the oral steroid. This is something that happens on occasion when we see colitis. If you experience these symptoms, typically your immunotherapy will be discontinued. But again, this is a life-threatening issue, and therefore that's why we want you telling us about it. Usually, immunotherapy is capable of affecting your system long after you receive the drug. 1 or more doses may be enough to switch your immune system and fight your cancer. We need to know all of your symptoms in order to deliver your care safely. At each visit, we'll be monitoring your liver function tests. It's a simple blood test. This is something we see in patients often, but this is not something you'll have symptoms of. We'll be seeing you every couple of weeks. We check your lab work, and if the 2 liver functions that we're looking at are AST, ALT, and also your bilirubin, and if it's elevated 3 to 5 times the upper limit of normal, we have to hold your therapy and treat you with corticosteroids. If this does not fix the problem, or if your numbers are 5 times greater than normal value, we would need to permanently discontinue your therapy as well. The pancreas is something that also may be affected. This also is typically by lab values, or if we see something in your CAT scan, or if you're having abdominal pain. The significance of this happening, if your lab values are elevated, we can typically treat you through it. So these aren't labs that we're always checking. But if you're having abdominal pain, discomfort, or if we see an inflammation of the pancreas on your CAT scan, that's when we'll check your amylase and lipase. So if you're having a combination of these symptoms, elevated values, abnormal CAT scan, and abdominal pain, we would typically stop your therapy and treat you with steroids. it's a controversial area of whether or not of the implications of pancreatitis. If you're asymptomatic, as in having zero symptoms and just have an elevated amylase and lipase, we would consider that tolerable and we would consider treating you. Some upper GI symptoms that we see are things such as nausea and vomiting on occasion or abdominal pain. Again, this is not very common. And what we'll sometimes do is when patients are getting worked up for their lower GI symptoms, they'll also give an endoscopy, which is putting a tube down your throat to see your upper GI symptoms. And sometimes they find that patients have gastritis or their duodenum. As with all immunotherapy toxicities, it's important to report all of these to your physician and nurse so that we can address these problems and avoid any permanent discontinue of your treatment and be able to treat your cancer. Please report to your physician or nurse any issues that you're having. I hope this was helpful. Thank you.